Hello friends, it's me Richu Sebastian. I am a BSc nurse. I am working as a registered nurse midwife in Saudi Arabia. I have 7 years of experience in labor and delivery. Thank you so much for the support you given for the last video. Please share this video. At least let it reach the person who really needs it. So, today I will discuss regarding polyhydramnios as I said in the last video. Last video we have discussed about amniotic fluid. In that we have said the amount of fluid more than the normal level is polyhydramnios and less than is oligohydramnios. So I am planning to take oligohydramnios on my next video. Today we will focus on polyhydramnios. An amount of amniotic fluid more than 2000 ml is known as polyhydramnios. So we know what is etiology. Etiology is known as the causes. There may be fetal causes and the maternal causes. The fetal causes may be congenital anomalies. So what all are the congenital anomalies which leads to polyhydramnios? The conditions such as cleft lip and palate, spina bifida, anencephaly, then esophageal and duodenal atresia. These all conditions will lead to polyhydramnios. It means the fetus is unable to swallow the amniotic fluid because of these conditions. So what happens? It won't swallow and it won't urinate. So the fluid amount will be produced day by day, but there is no intake and output. That's why the amount of fluid will be increasing. The other is uniovular twins. Uniovular twins is otherwise known as identical twins or monozygotic twins. The third cause is increased placental mass. It may be like the edema of the placenta, may be due to the Rh incompatibility, severe anemia, and cytomegalovirus. Then the second classification comes under maternal causes. There may be some maternal conditions which can lead to the increased amniotic fluid production, such as diabetes mellitus, pregnancy-induced hypertension, or severe generalized edema. So this severe generalized edema can happen because of the cardiac or hepatic or renal problems for the mother. Again, the polyhydramnios is divided as acute and chronic, and the most common type is chronic. Next I will say something regarding the symptoms. So when you think about the symptoms, you just imagine a mother with polyhydramnios, like a big belly, and on the inspection what you can feel, like the mother may feel the difficulty in breathing, right, and the swelling in the lower extremities as well as in the vulva, and the mother may also experience decreased urine production, constipation, heartburn, and the mother may also get the feeling of huge or tightness in the belly. When it comes to the abdominal examination, just imagine the fundal height will be more than the gestational age, and we will get very difficulty to find out the fetal parts. There may be the chance of fetal malpresentation, and the auscultation also will be very difficult. So these all are the symptoms of polyhydramnios. The investigations includes ultrasonography. By ultrasonography, we can find out the amniotic fluid index. Amniotic fluid index 8 to 18 is normal, and if it is more than 25, this is considered as polyhydramnios. We'll also do some investigations such as blood sugar, then blood group, because we have seen in the maternal causes there may be so many conditions. Then it comes to complications. So I will just list down the complications, that is premature birth, premature rupture of membrane, placental abruption. What is placental abruption? That is the placenta is peels away from the uterine wall. Okay, then umbilical cord prolapse. This will lead to cesarean section, sometimes stillbirth. Stillbirth is the baby is delivering as a dead fetus. Okay, then heavy bleeding due to the lack of uterine muscle tone after delivery. So there may be chance of postpartum hemorrhage. When it comes to treatment, First, they say about the drainage of excess amniotic fluid. So, how do we do that? It's by the amniocentesis. But most of the cases, the doctors won't prefer this method, as this will give a chance of getting infections to the maternal as well as the fetus. So, to the maximum extent, the doctors will avoid this procedure. The medications such as indocin will give to reduce the fetal urine production and amniotic fluid volume. The echocardiogram and Doppler ultrasounds will be due for the well-being of the fetus. Then the therapeutic amniocentesis, as I told before, and the treatment of the underlying diseases, such as we have seen the mother may have diabetes mellitus or pregnancy induced hypertension. So all these problems should be treated when it comes to the treatment part. Then during labor, what they will do AARR, that is the artificial rupture of membrane to induce labor. When this fails, they will go for the induction of labor with the help of sindosinone injections diluted in the ringer lactate. I hope you understood well about the polyhydramnios. You can make use of the notes. I have given that in my Telegram group, and the link is there in the description box. Thank you so much for the support. Please share the information to the nurses who really wants this. Thank you. Bye.